Well, I'm delighted to be speaking to you all today, because this is something which is very close to my heart as well, as you will see. So I guess what I will do is just share my screen now with you, and hopefully this will work. We did a test before and it did work, so fingers crossed. Okay, so can you confirm maybe, Aoife, if that's working okay?
Yeah, we Perfect. Can see that.
Okay, yeah. Great. Thank you very much. And I'll move this down here. Okay, so as Aoife said, I am based in the Department of Psychology at Maynooth University. So that's my main day job. And also I've had the pleasure of being able to join the board of MS Ireland last year too. I guess my main qualification in the context of this presentation is that I also have MS myself. So I am, like many of you on the call. I have relapsing remitting MS. I've been diagnosed for quite a number of years now. So I suppose I have a bit of personal experience in this area, as well as, of course, looking at it from the research side of things. So what I'm going to talk to you about today is, first of all, just general anxiety in the area of MS and what we know from research in this area. And then just picking up on what Aoife had said, we'll discuss a little bit the impact that COVID-19 may have had on those of us with MS, especially in terms of our psychological well-being and general anxiety. And then finally, again, looking to what we know from research in this area, some strategies that may help to reduce your anxiety. Okay, so first of all, looking at anxiety generally in the area of MS. First of all, we know it's a very common problem in the general population anyway. And when we get on to speak about COVID, this has become, there's a heightened awareness that many people may be at risk of suffering from anxiety. So it is, along with depression, it's the most common mental health problem that there is. We do know, however, that it's even more common in people with MS. So obviously not everybody with MS does have anxiety. But there are, we are as a patient group, let's say, slightly more at risk than those without MS. So some estimates would say that as many as 54% may experience some form of anxiety. This may vary a little bit, but suffice to say, anxiety is a little bit more common in people with MS. And also, women in particular are at higher risk than men. And those with relapsing remitting MS are at higher risk than maybe with more progressive MS. However, again, that's not to say that men or people with progressive MS, primary or secondary, don't suffer from anxiety. So anybody can. So a lot of research is concerned with, well, why do people with MS have anxiety? What factors might influence this? And this is a research interest of mine and many others in the area of MS. But I think it's useful to start actually with a definition. So if we think, well, what is anxiety? If you look at the definition of anxiety, this is kind of what you will find. A feeling of worry, nervousness, or unease about something with an uncertain outcome. Now, when you read that definition, especially in light of what's been happening in recent months, this will probably ring quite true for you, this whole idea of uncertainty. So not being sure what is going to happen. Now we'll get on to talk about the impact of COVID in just a moment. But uncertainty really is the hallmark of anxiety. Now in most extreme cases, this feeling can be quite debilitating and it can lead to anxiety disorders. So there's a range of anxiety disorders exist. These might include things like OCD, generalized anxiety disorders, specific phobias, and the like. You might have heard of some of these terms before. However, you don't need to have and be diagnosed with an anxiety disorder to experience level of anxiety. This can fluctuate, from everybody on even a daily basis at the moment. But, generally when we think about psychological well-being, it is good to imagine like this laying along a continuum. So anxiety has a continuum. If we think about, from the one hand, positive, healthy functioning, which is, you're happy, everything's working fine, to a severe impact on everyday functioning. Mental health really, to some extent, it lies along a continuum. It can vary from individual to individual and on a daily basis. And if we think about anxiety in these terms, having an everyday anxiety, that may actually be useful or helpful even Because if you think about it, anxiety has evolved to help us to avoid risky situations. So actually having a certain amount of anxiety is probably a good thing. It's protective. It helps us make, calculated and appropriate risk judgments, which are important in the situation we're in at the moment. The problem is if anxiety becomes more and more noticeable, problematic, and it actually begins to really interfere with the way in which you live your life, or anxiety that could be debilitating or indeed severe. So it does vary along this continuum. Now, I also want to talk a little bit about a particular type of anxiety that is very relevant in the context of the COVID-19 pandemic. And this is health anxiety. Now, health anxiety, it was formerly referred to as like hypochondria, you might have heard of, or sometimes the term cyberchondria is used nowadays. It's the idea, let's say, where you have a particular symptom and you type it into the internet and then suddenly you're going to die because of the results that come up. So people with health anxiety, they worry a lot about their health. They have a lot of fears about developing certain diseases. And, you can see that in the context of COVID, that health anxiety has become heightened probably in the general population, and maybe more so in people with MS and other chronic conditions. So, it may be associated with these kind of characteristics where we're catastrophizing, we're worrying a lot about our health, and we're worrying about the implications, say, of getting COVID, let's say. And even prior to, speaking about COVID, there have been studies looking at health anxiety in people with MS. And if you divide people with MS into two different groups, people that have health anxiety, they kind of tend to catastrophize about their health, and those that don't, they actually have quite different experiences in terms of their quality of life. So if you have a high level of health anxiety, you are going to feel worse within yourself, within your own quality of life, even in the absence of health problems. So in other words, your MS, let's say, could be particularly stable and there's no change in the clinical course or progression. But if you have a high level of health anxiety, you will feel worse. So there is, again, this strong connection between our psychological well-being and actually our physical health as well. So anxiety can impact, in particular for those of us with MS, it can have a negative impact. And actually, I spoke at the MS Ireland conference last year, and I touched upon this issue, and I thought it might be worth bringing up this slide again, because those of us with MS, we experience a lot of different worries and fears. Again, they can vary in their level of severity, if you like. People might fear, for example, the progression of their disease. They may fear that they might experience a relapse. And I should say we rather than they, because I'm in the same group here. We may worry about experiencing specific symptoms on a daily basis. So you can see here that there's a strong link between these worries and what I just mentioned about health anxiety. So in other words, there may be no reason to worry about these things, but yet they still can have an impact on our daily life. Like if you're worried that you might experience, fatigue or other symptoms on a particular day, that may, it may lead to a number of negative effects. And there can, of course, be more broader ranging effects or fears on maybe for social domains of life, like we might worry about the effect that our MS might have on our employment or stigma from others. So already, I guess, with MS, we are slightly at risk of higher anxieties and worries in different contexts. But then what happened? Then came COVID-19. So 6 months ago, most of us had never even heard of this. But within the last, say, 4 or 5-ish months, our lives really have been dominated by this. And there's very few people really within the country or even within the world that have not been somewhat impacted by COVID-19. So I just like this picture. It's the image of this, again, leading to anxiety, leading to fear. But maybe this image is pertinent because not all of us with MS can run as quickly as that guy can down the hill. So we might feel a little bit trapped in terms of what we actually can do. So really what research is suggesting is that COVID-19, the pandemic, has had a general impact on mental health. And the first kind of studies came out of China, unsurprisingly. And, these researchers found that things like generalized anxiety disorder, as well as depressive symptoms, sleep quality and the like, were actually impacted by the COVID outbreak. So they found that there was impacts on the mental health of people. Young people, interestingly, were at a higher risk of anxiety than older people. They also found, again, this third point here, probably not surprising, spending too much time thinking about the outbreak is harmful to mental health. And that point may resonate with some of you as well. The more you spend thinking and focusing about it, the worse maybe you will feel. These kind of studies then were later replicated in other countries. For example, within America, fear of COVID-19, and there's bigger problems within America and indeed UK probably than we have here in Ireland, but worries about contracting COVID-19 are associated with negative mental health consequences. Also, another study that was done in the UK recently suggests that there's quite a high prevalence of psychiatric disorders. So again, talking about generalized anxiety disorder, depressive symptoms among the British public. Now, if we think about studies within Ireland, one of my collaborators, actually, I was just speaking to him about this during the week, Philip Hyland, who is also based out in Maynooth. He's involved in a study which is looking at kind of a longitudinal changes in people's psychological well-being in the light of COVID and lockdown. And actually, this study suggests there's no increase in the number of people with anxiety disorders during lockdown. So, it's kind of mixed finding. It's not necessarily saying that COVID has led to this mental health epidemic. However, as you're probably thinking, what's this to do with me? This is work looking at the general population. What about people with MS? How is that impacting us? Well, there's far more limited research in this area. One study I did find, actually, this is based in Iran, but you can see just from the title what the conclusion is. One aspect of COVID-19 outbreak in Iran, high anxiety among MS patients. So many of you were saying, okay, that's a fairly obvious finding. Although this study is slightly limited because it just asked people now what their rate of anxiety is without controlling for it, without comparing to see what it was like maybe before the outbreak. There has been an interesting study done within Italy. And we know that there was quite a serious problem in Italy, of course, in the early stages of the pandemic. They were able to look at a sample of people with MS, take measures of their psychological well-being and compare that to their levels of well-being or anxiety and depression before the pandemic, because they'd actually already taken measures, based on routine clinical assessments. And they found there was no difference. So they were suggesting, well, people with MS are actually quite resilient. So they're quite maybe less affected than you might think by the pandemic. The problem, however, is that a lot of these studies were done in the early stages of lockdown. And if you think about maybe how your own experience has changed, maybe you're in a different situation now. So if we think about just the timeline, and this is just a basic reminder, I suppose, of what happened. If you think early March, we were becoming aware of the pandemic spreading. And I guess there may have been this heightened awareness or even anxiety among everybody, not just those of us with MS, but the wider population. The government then led to implement the various stages of lockdown, social distancing, closing places of work, limiting movement. Of course, then there was guidance for vulnerable groups. And many people with MS, not all people now, but many people with MS may have fallen into this category based on their own individual situations, based on the medications that they were taking, based on their levels of mobility, whatever that might be. Now, some people might have had an issue with the term and the messaging that was brought out at that time that may have a heightened anxiety, but it may have made other people felt safer, I should say. Based on these guidelines. But what is happening now? And this is why I guess talking about this now is important, because we're in a different phase now. We're actually moving out of lockdown. That's just a screenshot from queues out in IKEA the first days the shops opened. And in more recent weeks, we've seen pictures of crowded pubs, and the perception is that life is getting back to some kind of normal. But potentially there's some wariness and worry among many of us about maybe the pace of change. Now, last week so we looked at the research evidence. That's all well and good, but I was interested in seeing, well, how people with MS are actually feeling as we exit lockdown. So I just sent out a tweet on Twitter. Obviously, Twitter, of course, is its own little limited sample. So this, of course, is not going to reflect everybody with MS. But I was just interested to see, how do people feel as we are exiting lockdown? So I got some really interesting responses, and unfortunately, I can't go through all of them now due to the time, but some examples from people, and I just anonymized these, but some people saying, I've been going out once a week to do my shopping now for the past month. I was losing my mind stuck at home. So some people are moving out, let's say, into society. I'm adhering to social distancing, hand sanitizer, not using the mask, impossible to see. Other people then maybe cited the support from their MS nurse and their healthcare providers. So I've been seeing my MS nurse here each month for my infusions. It's been brilliant to see how they've responded to the outbreak. So it's nice to see some praise for the healthcare professionals here. I don't feel too confident having people in my house. You can't trust other people's behaviors. And this was a theme that came up on other responses too. Somebody else says, I'm anxious, I'm only going to the shop when I need to, getting most delivered, or home help, getting my meds, etc. I'm not ready to have them in the house yet. It creates issues for me. Sticking to seeing family, not going anywhere will be the norm for me for months yet, I reckon. And other people saying, my biggest issue has been friends not understanding why I don't want to go to crowded places like pubs. I miss them all. I'd love to see them, but the risk is just too much. And then other people kind of reflect these responses, a mixed bag, happy to be doing day-to-day tasks again, whilst being vigilant with mask wearing, sad to see so few wearing masks when out, also wouldn't dream of going to a busy pub or similar. So some of these might reflect your own experiences, and others may be completely off the mark. But what I think these kind of responses show is that, first of all, everyone with MS is unique, and we're all just individuals. I'd say if you ask the general public as well, there may be similar responses or variations in responses. There are, however, some shared experiences and kind of common themes that seem to come across. So common experiences included things like, obviously, this wariness, not trusting others' behavior, or frustration at the lack of compliance with the guidelines. So things like worrying about going into shops and people not wearing masks. I mean, I've experienced this myself. I think I'm certainly not alone in this. You hear stories going out to the shop, and that can itself give rise to feelings of anxiety where you maybe don't feel safe as you hoped you would. Little or no change from when in lockdown as well. So other people have said they're still cocooning, essentially they're still staying at home, they're not going out, they're not meeting people. And that might be it may be more difficult than it would have been in the early stages, when there might have been more the sense of shared community in the fight against COVID. But this feeling of worry seems to get across as well. And especially, although I haven't mentioned it in the comments I showed there, but especially for those on specific treatments that may theoretically put them at a greater risk. So these things are coming across quite strongly. Now, interestingly, again, just going back to another research paper in this area, one study was interested in evaluating the opinion of patients with MS on the outcomes of catching COVID-19, and really just asking people, what would you be most worried about if you caught COVID-19? And actually, people, the most common symptom, or most common worry, I should say, from this paper anyway, was actually the people are more anxious about the effects of COVID on their underlying disease rather than the infection itself. So I suppose it suggests again that people, those of us with MS, we may have additional worries about how the disease and how the infection may exacerbate our own symptoms. Again, that's just one study, and it's a kind of a small enough sample. I'm sure there'll be more research coming out in that area. But I think it is interesting. It does show, and it does recognize that people with MS have additional worries as opposed to just the COVID itself. Okay, so that's just some insight into what we know in terms of research on anxiety and COVID, and also just the general feeling, certainly, that I have from the MS community on their worries about, what's happening as we enter lockdown, or exit lockdown, I should say. So how can we maybe cope with anxiety? I think a nice distinction to make here is the distinction between the things that we can't versus the things that we can control. So there are some things we can't change. So we can't, unfortunately, make people wear more masks. I mean, obviously there can be guidelines put in place or indeed directives from the government, but we personally cannot change other people's behaviour. There are other things, of course, we can change. So you can change maybe, but not just your behaviour. There are things you can also change about your outlook and other things maybe that you can do. And what I'm going to do is talk about these in a moment. So I guess represented here by this picture. So everybody, you know, you don't have to worry about what other people are doing. Just worry about yourself. And this is something which I'm particularly interested in. Even before the COVID situation came about, I'm working on a project with one of my postgrad students at Maynooth, and we're looking to try and understand modifiable factors that are associated with anxiety. So again, modifiable factors are just things that can be changed. So we know, like when I mentioned one of my earlier slides, I mentioned things like women are at greater risk, or, you know, type of MS. So like you can't change your gender or your age or your disease stability or whatever that might be, but there are other things maybe you can change. So if we can understand the things we can change, maybe we can target those to reduce our anxiety. So broadly speaking, what we are finding is that there are three core sets of modifiable factors. So there's these broad psychological factors, which I'll speak about in a moment, social factors, and then lifestyle factors. There may be others as well, but broadly speaking, these are the things that are coming up again and again based on research evidence. So in terms of psychological factors, the way I like to think about it is, how can we actually foster positive experiences? There's a number of different ways we can do this. First of all, this construct, self-efficacy, comes up again and again when you look at research in the area of MS and psychological well-being. Self-efficacy really is your self-confidence in your own abilities to, you know, might involve manage your MS or do certain activities. We all have our own limits. Of course, everybody has different limits. Even on a daily basis, people with MS may have different limits. I think being aware of those and thinking about what you can control, what you can do, can be really helpful. So again, it's just that taking back control. A concept related to this as well is self-compassion, being compassionate and kind towards yourself, and actually focusing on the positive things. When we're talking about anxiety and this whole idea of uncertainty, uncertainty is geared towards, what may or may not happen in the future. There is some research to suggest that people that are more optimistic and have a more optimistic outlook tend to fare better too. So even though we don't know what's going to happen, if you focus on positive thoughts, that can be a useful way of maybe easing anxieties. Because, even if you think about the context of COVID, this is not going to go on forever. It will end at some point. I know we don't know when. I know we're maybe waiting for a vaccine and the like. We can't put a time point on it. But, if you focus on positive thoughts about the future, that can be helpful. On the flip side, then, avoiding this concept, which I mentioned earlier, called catastrophizing, which is fearing the worst. So obviously, as I mentioned, a bit of anxiety maybe is useful. It helps us avoid risky situations, but it's also important not to really overestimate risk as well. Particularly in terms of when we're reading things in the media, there can be this perception that it is such a catastrophic situation. It's just a disaster, but maybe it isn't as bad as that. And related to these issues is also learning to develop a tolerance for uncertainty. So it is an uncertain situation. Within MS, there's interesting research suggesting that if we tolerate the uncertainty, not just for the COVID situation, which hasn't really been researched in depth yet, but certainly within the context of tolerating the uncertainty that comes hand in hand with MS. We don't know where we're going to be in the future or how we're going to feel, but being okay with that and accepting that seems to be a useful strategy for enhancing people's psychological well-being. Now, I also mentioned social factors. Social support is incredibly important, and we know that this can reduce feelings of anxiety in MS. However, there, you know, this, I like this cartoon here, and there, like, it's a bit difficult to do in the context of COVID. So especially when we have to maintain social distancing, maybe even more so for those of us who are cocooning, it can be difficult. Thankfully, of course, technology is a great way of helping build connections if you are isolated. So we've all learned that, I think, over the last few months anyway. It may not be a perfect substitute, but it can be very helpful. And there are a number of MS support groups and social media as well, maybe, that can help build those social connections and foster that sense of peer support as well. There's other strategies, of course, that may help in terms of easing anxiety. Lifestyle changes. Now, I have in brackets "if possible," because I think you have to be aware all of us are different, and all of us have different levels of capability in terms of our abilities to change our lifestyle. You're probably familiar with the Holy Trinity: sleep, diet, and exercise. And of course, by looking after these things as much as we can, it not only increases our physical health, but also our mental health too. In terms of exercise, I don't know if any of you follow Professor Susan Coote on Twitter. She's been tweeting some excellent tips every day recently in terms of ways that exercise can help people with MS. Even those with limited mobility, there are ways, yoga, sitting down and the like, that can actually enhance your exercise or your physical and psychological well-being. Also, there is some research supporting the practice of mindfulness, and that can be quite useful potentially in easing anxiety. Because if you think about the concept of mindfulness, really is that if your mind is full, you are thinking and you're focusing on so many different things. Let's say you're focusing on COVID, you're reading all the news, you're worrying about what may or may not happen, your mind is full. Mindfulness is just really trying to empty all those thoughts in your mind. And there's lots of good online supports and programs, you know, to help people get into the practice of mindfulness. Now, I must say, this is something I don't have the patience to do myself, so I appreciate it's not for everybody, but it certainly is something that may work for you. Another important thing, and I mentioned this briefly before, just the news exposure, limiting exposure to news and coverage of COVID-19, because often the news will, you know, catastrophize the situation. And to a certain extent, it's good to be aware and to be kept up to date, but that can be quite overwhelming. I know I've certainly stopped paying as much attention to news and coverage of COVID recently. In the early days, was just eating it up. I'm sure many people were listening to all the news bulletins that you can, and reading so much about it. There is, I mean, before I get on to the next book, there is, of course, reliable sources. If you do want to get information, look to reliable sources. But also just thinking about things that you enjoy. I guess everybody has their own unique things that they like to do. When we think about research tends to focus on the group or people of MS as a whole, but it's very important to appreciate the individual differences that exist within this too. And also, I mean, I know there's a chat function as well. So if there's anything else that I haven't mentioned here that you feel helps you personally, feel free to share it in the chat as well. So just to sum up then, first of all, if you are feeling worried, I think the important thing is to emphasize that you are not alone. This is a shared experience. You can see it from the comments from others with MS. It is a perfectly normal reaction to have, and that's perfectly okay as well. So you're not alone. The thing is to focus as much as you can on the things you can control. We all have some control in our lives, regardless even of our level of mobility. You know, that we can always have some autonomy over our lives, whether that be in our behaviors, in what we think and focus on, who we speak to, how much news we digest, etc. So thinking about, you know, empowering yourself, I guess, to take back control as much as you can. It's also really important, though, to seek support. So not only maybe seeking out social support from your friends and family, but also from other groups and peer support and the like. If you are concerned, though, you should contact your healthcare professional or even the MS Ireland for advice, because anxiety, as I mentioned, it lies on a continuum. I guess the things I'm talking about here are intended to help people that have maybe, let's say, low levels of anxiety, If anxiety is extremely debilitating, it is very important that you seek support. There are fantastic psychological supports available out there, and different therapies and therapeutic courses of action that can be availed of. So do seek support if you're concerned. And also Aoife just mentioned to me that there will be an MS Wellness page, which is fantastic, launching on the MS Ireland website on the 22nd of July, which I believe is National Brain Awareness Day. I think so that, there are so many resources and supports out there. So, seek them out. So I think that's me, certainly from the talking part anyway. So I would like to thank you very much for your attention. I'm going to stop sharing my screen now. Okay. And there may be questions in the chat, but Aoife actually passed on some questions to me that others had emailed in, so might deal with those too. Is that okay, Aoife? Will I go on to the questions?
Yeah, absolutely. If you'd like to, just, I suppose we'd like to say thank you very much to you, Rebecca, for doing it. It was a very interesting presentation, and I think that a lot of people will be able to relate to some of the common experiences that you described. And it's great to have those practical tips and tools on differentiating between what you can and can't control, and limiting your exposure to media, and to maintain that level of confidence in yourself and in what you can do too. So I think that that's going to be really helpful to people, and thank you so much for taking the time to chat to us all this evening. And yeah, if you wouldn't mind answering some questions, we'd really appreciate it. Thank you.
Thank you so much, Aoife. Okay, so I'm looking at a few of the ones that were sent in. I might have covered some of these kind of issues a little bit in the talk. One question: what are some ways to manage COVID-19 related anxiety when returning to work? So although this, I suppose employment law, let's say, is outside my own area of expertise, I know that there is some obligation from HR or from, occupational health and employers really to provide supports for people returning to work that may be vulnerable. I guess it very much depends on the context in which you work in and the sector. A lot of people may still be working from home, and a lot of people can still be supported working from home for quite some time, which is great. So I think the key thing with there is to speak to your employer or your HR officer and voice your concerns. I think, there is an obligation there from the employer to help, maintain or ensure that your transition is as smooth as possible back to work, and also that there are health and safety standards to uphold. But I guess some of the other tips might come in there in terms of seeking social support from your colleagues, making them aware of your fears, and just being as open as possible in terms of your communication. Okay, another question. Okay, so I didn't deal with this too much in the talk. I'll just read out this question. Cocooning and fear of the lingering threat of COVID-19 has caused a withdrawal from social interaction and increased isolation. Do you have any suggestions on how to cope with the emotional effect of this? So yeah, again, that's a tricky situation, I think, and it's probably something that may resonate with many of you on the call today. Especially, I did mention in my talk the fact that many people are still cocooning now, and that is a long time to be socially isolated, especially for those who are living at home. I think, trying as best you can to maintain those social connections and keeping in touch with others. And I suppose you have to be satisfied. In a way, whenever we meet individuals, I think as we all relate to this, we are taking some risks. We're taking calculated risks. But if you are comfortable, say, having people visit your home or visit others' homes and keeping socially distance, then, that can be fantastic. It is very much an individual decision. But again, there are many psychological supports available. Like if people are really suffering, I would definitely suggest reaching out and maybe contacting the MS Society for advice too. Okay. The next question, I understand that physical exercise has a significant role in mitigating anxiety and stress. And that's what we talked about. Are there alternative ways of obtaining these benefits for someone who is quadriplegic or has difficulty getting physical exercise? Yeah, so as I said, like say following Susan Coote, for example, on Twitter, some excellent suggestions. I think, I mean, it is obviously hard when you are limited, when you've limited mobility, especially, you know, somebody in a quadriplegic situation. It's very difficult to get that physical exercise. Again, I guess focusing on those things that you do have control of, going back to the key message, I guess, in my talk, can be beneficial. But definitely there are supports, and maybe getting in contact with like physiotherapist, occupational therapist, or OT can actually maybe offer some good advice there. I'm just let me see, I'm just checking, is there anything on the chat? Oh, I see Susan is on the call. I didn't realize you were there, Susan. Hello. She just says thank you. It's important, the important thing is to move more, move what you can when you can. I think that's actually great advice. One other question Eva sent on to me. My PSB, pathological laughing and crying, is made worse during COVID. Any suggestions on how to deal with this? Again, I will always admit that this is outside my own particular area of expertise. So I would definitely suggest you go back to your treating consultant if concerns over this, because as far as I understand, there are medications for this, which may be an option. But I think, again, focusing on really the key causes of the exacerbations of symptoms can be useful too. So is it something to do with your contextual situation, social and psychological context? Are there factors that you can generally do, like some of the ones I mentioned today, that may help ease your anxieties and your fears? Also, probably communicating with others too, so people are aware. You know, I think this probably applies for all of us. If we are honest to others about the symptoms that we're experiencing and the worries, and they can be physical or psychological symptoms, they can actually be quite helpful. Sometimes there is a tendency for us to be a bit embarrassed about the symptoms that we have and to bottle it up. That can actually lead to a vicious cycle and make things more difficult. I think we're open and transparent with people. And again, going back to that idea, which I mentioned briefly, self-compassion, being kind to ourselves, being okay with what we are feeling, that can also be quite, you know, that can be a good, just general starting point, being kind to yourself. Now, I'm going back to the chat. Is there anything? Oh, I can't see anything in the chat now. Sorry, I'm looking at this and speaking. Thank you. Lots of people saying thank you very much. So thank you for that. Does anybody else have any other questions or comments, or even other ideas for what helped them in their own lives? Do feel free to share, because I love hearing from everybody else, because I think sometimes we can be quite siloed. I mean, certainly as an academic, I can be quite, you know, my orientation is looking at the research evidence, and you can be quite distant. And then I have my own experience, but I think actually hearing firsthand from others can be really helpful. Oh, here, sorry, I see now we have a question here. I'm just going to read it. I felt very safe because I've had nobody in my home over the pandemic. I'm feeling under increased pressure by family. Oh, sorry, it's disappeared. The joys of technology. By effectively communicating. I'm feeling under pressure by family to make any tips for effectively communicating my concerns to family members who do not share my concerns? Yeah, that is a tricky one, and I think you could see that even from the Twitter comments I put up. It's very hard for people to understand the concerns. Again, I think just being as honest as possible. I mean, even if you want to send them information from the MS Society, you know, and in terms of the information that is out there in terms of keeping safe with COVID, and just feeling that you don't feel comfortable, and even stating, you can even say that you were at this presentation today, and things like, if people aren't comfortable with the level of risk, then that can risk their psychological well-being. You don't want to exacerbate your symptoms and the like. You know, I think honest, open communication is so important. As much as you can. Sometimes you might have to repeat yourself a few times for it to sink in. But I do appreciate it. You know, it is a problem. It is difficult sometimes when there's that lack of understanding. I see Mark here's would comment, the weather has been great, plus until recently I found I totally agree. Although it is nice today, it's sunny today, so let's hope that things are picking up for that. And that definitely, you know, the weather, you know, definitely have an impact on your mental health and well-being for some more than others. So I guess it is, I'm just looking at the time, yeah, it is 5:45. So I suppose we probably wrap it up there. I don't know, will I hand back over to you, Aoife, at this stage, if you're there?
Perfect, yeah. So thanks so much for answering those questions. I think lots of people will really benefit from them, because I feel that the questions that people have are really shared throughout the community, so it'll be really beneficial. So thank you to everybody who submitted a question, and thank you to everybody who's provided a comment in the chat, and thank you for joining us this evening. We will be making the video of this webinar available on our YouTube channel in the coming days. So if there's anything that you want to check again, or if there's anybody that you feel would benefit from watching this who wasn't able to make it to the live event, please know that this will be on our YouTube channel, so that it can benefit as many people as possible. Again, Dr. Rebecca Maguire, thank you very, very much for giving us your time this evening and for the wonderful presentation. Much appreciated by all of us here in MS Ireland.
Thank you so much, Aoife. I've really enjoyed it.
Okay, thanks everybody.
Thank you.
Bye.